Welcome to Webinar Wednesday. I'm Nikki with the North Dakota Brain Injury Network, and just going to give you a little introduction about the North Dakota Brain Injury Network. In 2019, legislation passed changing the definition of brain injury for North Dakota, allowing NDBIN to be inclusive of all types of brain injury. This allowed us to partner with the North Dakota Stroke and Heart Association to collaborate and provide things such as this. About Webinar Wednesdays, the Stroke Association and NDBIN wanted to create this platform to provide information on resources available throughout our state and beyond. If you have any topic or suggestions, please contact Kari, and her information is there. Today's presenter is Kim. She was a labor and delivery nurse at Altru Hospital in Grand Forks for many years before changing to her new role as stroke coordinator last winter. Kim is passionate about making sure that the medical field is accommodating to individuals with special needs that come into contact with, and listen to Kim as she tells about her sister's journey and unique needs. And here you go, Kim.
Thank you. Let me just make sure I can do this right. Can you see it?
I cannot.
Oh, darn. Let's try this. What can you see?
I see nothing. I just see the person, like your name.
Huh.
Oh, there it is.
Okay. Yay.
I see it. Yay.
Okay, awesome. Hey guys, I'm Kim. Still there? Okay. Nikki, you can still see it?
Yep, it's there.
Oh,
sorry,
okay.
I was on mute.
That's all right. So I am going to be talking about two stories. Both involve my sister. I am an Altru employee, and I've been an Altru employee for 12 years. I started, most of my years were in labor and delivery, and then just recently I'm now a STEMI and Stroke Coordinator, STEMI meaning a heart attack. But this story is mainly about my sister here. Her name is Kari. She is sassy. We are 11 years apart, and she has Down syndrome. So a little bit about Down syndrome is that it's very common for babies who are born with Down syndrome to be premature. So she was born about, I think, 28 weeks, so which is very premature, and she was actually at the Altru NICU when she was born. Very common to have any cardiac abnormalities, and the slanting of the eyes, the flat feet. So one thing is that 1 in every 758 births, a baby is born with Down syndrome. And in 2013, there was 11 in North Dakota, 125 in Minnesota, and 533 in Texas, just to put that into perspective there. My sister had a normal life growing up. She was able to talk, and we have a brother in between us, so growing up with him. She attends the Buddy Walk. She was in Special Olympics as a child and was a runner. And at a young age, she actually did have a stroke at a very young age. They actually just called it a prolonged seizure so many years ago. And so she lost her ability to communicate. So she can still walk and feed herself and dress herself, but she can't talk anymore. With Down syndrome, it's been known that there's significant cognitive deficits. Dementia is very common, and it actually starts in their 40s to start developing. So 4 years ago, my sister was at an adult life skills facility, and we received a phone call from there saying that Kari isn't using her left side. And it just started and she started being very clumsy. Could you come get her? So of course I was the only one home at the time, and I went to her job and she was sitting in a wheelchair, and I asked why, and they said, well, she wouldn't get up. So we had her in a wheelchair. So I was like, well, let's get out of here. And she went in my car just fine. And I called my mom from her job, and she was finding replacement, and we met at the house. And we pull up to the house. Kari gets out of the car like any other day, and then she does a stumble, fall. And she's reaching for the door handle, but it's actually more like 5 feet away from the door handle, which was very abnormal. I said, Mom, I'm pretty sure that Kari's having a stroke. We have to get her to the emergency room. So me and my mom escorted her back into the car, which I'm going to tell you, as a stroke coordinator, that is not recommended. You should call 911. But my mom and I were right there, and we were really just nervous about what was going on. So I actually called the ER ahead of time and told them that we were coming for a suspected stroke. So we get to the emergency room, greeted by many staff members. We get in there and they're trying to evaluate my sister. The only thing is that she's nonverbal and can't follow commands. That's her baseline. So when you're assessing a stroke, you have somebody lift up both their arms and close their eyes to see if there's any drift in one or the other arm. She can't do that. Sometimes you ask them to repeat a phrase, like you can't teach an old dog new tricks. She can't follow those commands, so we had to kind of specialize this assessment for her. I would ask her to give me a high five with each arm, and she was actually very weak on the left side. She was very drowsy. She wouldn't walk, so so a few ways to diagnose a stroke is one is a CT scan. And so when you do a CT scan, you're actually looking to see if there's any bleeding in the brain, a hemorrhagic stroke. So they did that scan and they didn't see it. Then the next one is a CT with angiogram. So then they give dye and like look at the blood vessels within the brain, and then they also do an MRI. So we actually did all those for Kari and with Kari, and suddenly we're waiting for results, and she actually fell asleep in the ER, and she needs drugs to sleep. So I knew that this was completely abnormal and not her normal. So they actually thought she had had a seizure, and it's very common for people to become very sleepy after a seizure. So they were actually walking in with anti-seizure meds and getting a room ready for her at Altru. And as they were hooking her up to the medication, the staff came running in and said, no, stop. She's actually having a massive stroke. She needs to be transported to Fargo. So this picture right here, you can actually see, so it's the left side of the screen, which is actually the right side of her brain. There's not as many white squiggly lines, and that's actually the blood flow of the brain. When reading the results, it says an abrupt cut of blood flow to her MCA. So this is a little bit of information on the MCA, the middle cerebral artery, and all of what it functions. So a little bit for her, one is that sensory and weakness. So you can see that's one of the symptoms, and she actually had that. She didn't have the eye deviation. We couldn't ask her about any blindness or visual changes. We couldn't ask her if she had any verbal difficulties, and we couldn't ask her about if she could feel certain sensations or not. We had to really go with the high fives, and she kind of does a baby talk to see if that was even slurred. But there was that cut there on that CT. And here's another one you can see on the left side of the screen. Once again, that's the right side of her brain, that the white squiggly lines aren't quite there. And again here. So one thing that they give for this type of stroke, which I'm going to also go over, or you can refer back to the previous presentations from a stroke coordinator, but is a medication called Alteplase, or TPA. So that breaks up a clot. An ischemic stroke is what she had. So they gave that medication and said that she had to be transferred to Fargo because Grand Forks Altru unfortunately doesn't do endovascular therapy. So we were transferred to Sanford. I got to ride in the ambulance very fast with my sister, with my parents following. And they go through the groin and up into my sister's brain to grab the area that was having the blockage. So this is what it looks like. Left side is obviously the blocked photo, and the picture on the right is when they remove a blood clot and you get that perfusion or that blood flow back. So transferring was definitely needed from Altru to Fargo. The ride was very fast. It was probably about 45-minute transfer, the fastest way to get to Fargo. And we got into the back of the Sanford in the ambulance or the emergency room, and we were greeted by 25 staff members asking me a lot of questions. Does she have any allergies? What medications is she on? Are you okay with this procedure? Are you the next of kin? It was actually very scary because I didn't know what was going to happen with my sister. At the time, I was a labor and delivery nurse, so I wasn't a stroke coordinator like I am today. And I signed some papers. They did another emergency MRI or perfusion scan to see where the blood flow is. And there she went. I was left in a waiting room by myself. I did start crying because I was like, this is very scary, frustrating. My poor sister can't tell me what she wants. My parents aren't here yet to tell me what they want. So I waited for about 15 minutes before my parents got there. And then we waited another 45 minutes to an hour. And the doctor came out and said she's doing fine and gave me a photo of the clots that they removed from her brain. I like to call them Tom, Dick, and Harry because there's 3 of them. And there we were at the Fargo Sanford ICU. And you can see there she is moving her left hand, which before the procedure she was not able to. So it was so great that it worked, even with how scary it was. The thing that we knew right away is that I'm thankful for is that the people who were taking care of her at her adult life skills facility could tell us when she was last normal, because that's so important and that's involved in a stroke, is knowing when the last time that person was normal. They did a lot of therapy with her just to see if she could keep her strength. So they developed this, I don't know where they got this, the PEDS unit or something, but so that she would unzip things, unvelcro, revelcro, tie things up, just because following the commands were kind of difficult there. So the reason that she had a stroke, so it's actually it can be expressed across all ages in Down syndrome. There is so the congenital heart disease, cardiac arrhythmias, and then there's a moya disease that can be that can cause clots. So for her, she was born with a hole in her heart, and it was repaired, but the mesh from the repair didn't grow with her heart, so it developed into another hole, and that's what was causing a blood clot and then traveling to her brain. So for that, she is now on wonderful blood thinners for that. So some things I want to talk about too on top of that is how to communicate with Down syndrome or even autistic individuals. So if for some reason you come in contact with somebody who has one of these, it's not about high functioning, low functioning. It's about what's the best way this person communicates. What are their limitations? Or talking to them as if they maybe don't have Down syndrome or autism. How are you today? What do you got going on today? Versus, can you do that? Or is that one of your limitations? They're trying to, research is trying to tell you to go away from using the terms high functioning. Worst of all is using the phrase that a person is suffering with autism or Down syndrome. They're not suffering. So we hung out in the Sanford ICU for a week, and she was up and moving pretty quickly, excited to eat food again. So a little bit about stroke, which I'm sure if you go back into the presentations from Geraldine, she can tell you a whole lot more, but I'm just going to brush up on it real quick. So there's two main types, ischemic and hemorrhagic. One is with a clot that blocks the blood flow to the brain. The other one, hemorrhagic, is bleeding occurs inside or around the brain tissue. 13% of strokes are hemorrhagic. Hypertension is usually the cause. And then ischemic is 87% of all strokes. So my sister had an ischemic stroke. There is a third one called a TIA, or a transient ischemic attack. These are brief. That's a warning sign that your body's like trying to tell you that something's not normal, please get checked out. And there's a 40% chance that people who have a TIA will come back within a year with a full-blown stroke. This is the new acronym from American Heart Association. So it used to be FAST, now it's BFAST. So B for balance, I is for eye deviation or visual changes. F is for facial, A is for arm or limb weakness, S is for speech, and T is for time, very critical for time. If my sister's adult life skills facility ignored her symptoms for more than 3.5 to 4.5 hours, she couldn't have gotten that blood clot medication to break up the blood clot in her brain. So it's very important that if you suspect a family member, friend, coworker, to try and think about that time that was last normal for them. So she came home and regained everything that was back to her normal baseline, moving that left arm, left leg, walking fine, eating fine. Went to the casino, she won money. So now there's another story about my sister. That was about stroke and her complications with that. But if we fast forward 2 years from then, or 2 years ago from today, we're back in the hospital. My mom had brought her in for cold symptoms, hoping that it would be just a quick urgent care visit and get some antibiotics and be on her way. But while they were checking her pulse ox, the amount of oxygen moving through her body, she was actually sitting in the low 80s, which is very abnormal. And that bought her an ER visit, where we are here, right here, not thrilled. They did everything they could in the ER to try and get her to go home. They were trying some breathing treatments, give her some IV fluids. They tested her for influenza, that was negative. They checked her urine to see if it was infected, that was negative. They did a chest x-ray. Basically, the doc said, unfortunately, can't discharge her because of how low her oxygen levels were. So we stayed in the hospital where she was doing some breathing treatments. They were thinking some pneumonia was going on, possibly a false negative on the influenza, and they were going to recheck. But unfortunately, on day 3 of being admitted, she coded, which means, so we're watching TV, all the family members, and she suddenly became combative and confused and pushed all 4 of us, there was a sitter in the room, 4 of us out of the way and started walking. So me and my dad got under one arm on each side and walked with her. She's a very difficult patient, very ornery. And she was guiding us towards the bathroom. And as soon as we got to the bathroom, she lost all the color in her face. And we lowered her to the ground and her eyes rolled in the back of her head. It was a very scary moment. They called what's called a code blue, which means this person is not doing well. This moment, I was thinking, I did not want this to be the last moment that I'm going to see my sister in my arms as we're on the bathroom floor. So me being a nurse, I'm trying to do everything I can as a nurse. So I kind of rub her chest, I say Kari, and then I realized that this is my sister. I'm the family member here. I told the nurse I can't be in here. I ran to the hallway, we're crying. We don't know what's going on with my sister at this time. I don't know if they're doing chest compressions. I don't know if they're intubating her, putting a tube in her throat. I don't know if she's still there. 10 minutes go by. And me being an Altru employee, I know everybody who's in that room. I know the charge nurse that shows up, the nursing supervisor, the paramedics that show up, the lab tech, the list goes on. And one of them pops their head and goes, she's fine, but she's probably gonna go to the ICU, which made perfect sense. So we get to the ICU. What had happened is that when she ripped her mask off her face because she became combative, is that her oxygen level dropped so low that she couldn't function. So here we're in the wonderful ICU. She's got her stuffed animal there, being monitored frequently. 2 days go by and the doctors say, there's nothing we can do right now. I think that her lungs need a rest. I think it's important that we talk about intubation. So I am the only person in my family with a medical background. So when my parents hear intubation, they think it's end of life care. I had to reiterate that multiple times, and I had to get the doctor to come back in and re-explain it, that it's not end of life care. It was for her lungs to rest, for her to rest so that the machine can do the breathing for her. Because at first they were declining that she would be intubated. And so she got intubated. This wonderful picture on the left is the room that they put you in, with nothing in there but a Kleenex box and 3 chairs. I was terrified that in the middle of intubation that they were going to have to code her again, but I didn't hear it. This was another terrible day. I would trade anything to be in that position. My sister, who's nonverbal, can't understand what's going on. Why are these people bugging me? Why do I have a tube in the back of my throat? I would have traded the world to be in that position instead of her. When you walk into a room and see your family member with a tube down their throat, it's terrible. It's not even real. It was a very bad day. We got the diagnosis of ARDS that day, and ARDS stands for Acute Respiratory Distress Syndrome. There's a 50% chance of mortality rate with ARDS, and when the doctor was telling us this, that was medical jargon to my parents, so they didn't actually hear it. I did, and I started crying right away, because then I realized that he just said that there's a 50% chance that my sister will not make it. And now she's intubated. So that picture on the right is with, they put restraints on when you're intubated. That way you don't pull out the tube in the back of your throat. Many medications, I call this the Christmas tree of IV fluids. I had to be the middle person for my parents. Once again, at the time I was a labor and delivery nurse, so I didn't know everything that the doctors and nurses were explaining and saying, but I could keep up, and then I would reiterate it back to my parents. I had to explain a lot of stuff. I had to look up a few things. I had to ask lots and lots and lots of questions. Lots of beeping noises. My parents just sat there and watched their oldest child intubated and having trouble breathing. It was winter time, which is the worst time ever. And me and my mom and dad all took the full week off from work, which was normal because we didn't know what was going to happen the next day. And that was one thing that the doctor had said, is like, let's take this day by day. And I kept telling myself that because we have to worry about today, not tomorrow, not yesterday. Yesterday sucked, let's deal with today, and hopefully tomorrow will be better. And they would play with these machines and alter her breathing machine and their medications to try and help her. Here's a video of her when they alter her pain medications. She would reach out and grab for my hand, which was just so heartbreaking. So I basically just held her hand and sat there and didn't move for hours. So the picture on the left is her giving me and my mom a death stare of what is happening. I know she wanted to talk to us, even though she can't talk. I know that she wanted to talk to us. Picture on the right is the wonderful whiteboard that they update and update. The nurse was, all the staff were amazing. The nurse said, "What does Kari do when she wasn't here?" And we're like, "Well, she, you know, watches musical movies and eats some junk food." Who doesn't like junk food? And Rachel had asked, what's her favorite junk food? And she said, we said cotton candy. So you can see there on the lower right hand of the today's goals is cotton candy. Besides the have a bowel movement, rest, it also says cotton candy. So she added that on there for a overall goal is to get her some cotton candy. This was the view into the room. Just this little lady with all these machines helping her breathe, getting her nutrients. We went back to work after a week when we knew that this wasn't going to be a quick discharge. It was torture working on the floor below her on the labor and delivery unit. Could not get into the mindset of patient care, knowing that my sister was on the floor above me, intubated. And of course, it was Christmas weekend, my holiday to work. That was awful. It did not feel like the holidays. It was not the same. And during my lunch break, I came up to see her and ask how things were going. And the nurse was amazing, absolutely amazing. Her name was Tracy. And she would, all the nurses have little walkie-talkies on their necks. And she would actually call my walkie-talkie while I was at work and leave a message and just saying, "Kari's doing great, she's watching Annie," or "Kari and I are just watching The Sound of Music, she's doing awesome," which was so sweet that it just made my day. It was just what I needed to hear, the support from that staff, because they knew I was either, you were either going to see me twice a day or all day, or you're going to hear me calling 2 to 3 times a day. I was the annoying family member. So I think she was just trying to work a step ahead by calling me herself. But she had said, "Look into that room. What do you see? It doesn't look very happy. It's very gloomy. What can we do to lift up the spirits a little bit?" So this picture, I had gotten my OB coworkers to dress up and go into her room and sing a Christmas carol. I am not playing that video for you because we are terrible singers. But here's a photo of us. Kari didn't really care, but I think it just cheered maybe everybody up for a second. The picture on the right is Christmas Eve, the day that our family opens up Christmas gifts, and it just sucked. It was not the same. Very gloomy. I wish my sister was there to open up Christmas gifts. The next day, she turned around a little bit. The doctor came in the room and said, "You know what, get her sitting up on the edge of the bed, get her moving a little bit." So the picture on the left is her sitting on the edge of the bed. You can't tell this, but I can tell that she's actually smirking a little bit. I think she enjoyed kind of moving around. It was just like, I needed to see her moving. And this is another wonderful thing. So she loves Michael Jackson. So we fashioned that iPad to play a Michael Jackson music video for her. Which was great. I think that kept her busy. We also had Sadie, the therapy dog, come visit. Huge Great Dane. I think that was just nice for all of us to see. And well, this is kind of out of order, sorry guys. So one day they were going to be doing a blood draw, and instead they said, we're going to extubate, she's doing great. So this is us in the family room waiting for them to take out the tube in the back of her throat after 17 days of being intubated. 17 days with a tube down the back of her throat to help her breathe. And we walked into this. She was sitting up on a chair with a high flow nasal cannula, is what that is, no tube in the back of her throat, watching this Annie. So she made some motions at us like, okay, you guys, I'm ready to get out of here. But I want to go back just 2 slides. So we did end up giving her some cotton candy with doctor's approval. So she got a little taste of her favorite candy there, which was so cool. And 2 days later, she was transferred to a different unit. So here we are sitting on a different floor, less monitors, not a private room, but it was private for us, and a whole different batch of complications for us. So, or difficulties. The doctor came in and said, you know, Kari has Down syndrome. And me and my mom looked at each other like, is this a quiz? We didn't say anything. And he goes, do you know the life expectancy of Down syndrome? And I treated it like I was back in nursing school wanting to answer right away. And I said, well, it used to be 45, but now it can be as old as 65. And he said, right. So I was wondering if you wanted to make her a DNR. And then I was looking, and DNRs do not resuscitate. And I'm thinking, we just met you. We just got out of the ICU. And you're asking the mother of this child for 40 years if she has Down syndrome, which we know. And the last thing we want to hear is that she should be a DNR. How about we deal with the respiratory failure first? And we'll talk about the Down syndrome later, because unfortunately we can't cure Down syndrome, and we love her the way she is. I got a little defensive, and I actually said some of those choice words to him, and then I told him not to come back into my sister's room ever again, which was a little unprofessional on my part, but also unprofessional on his part. I'm wondering if maybe he just was trying to think outside the box, like, hey, she was really sick. If this happens again, do you want to go down that same road? I guess it was just, I thought it was the wrong thing to say for the first 5 minutes meeting you. That's not what we wanted to hear. We wanted to hear, hey, Kari's out of the ICU. Congratulations, that's so great. Let's talk about what we're going to do next on a respiratory level. So I put this up from the National Down Syndrome Society, saying that quality educational programs, a stimulating home environment, good health care, and a positive support from family, friends, and the community enable people with Down syndrome to lead fulfilling and productive lives. Just because we needed to feel this quote, because you know what, we weren't there for Down syndrome, we were there for respiratory failure. But it didn't matter when you had great support from your friends and family. My coworker actually was in her room and left this wonderful note. Just made me feel good that my best friend was watching over my sister. And then we got transferred to transitional care. So you can see her in a wheelchair, and off we went. And she's got her stuffed animal with her still. And then she was, again, a non-compliant patient where I would walk into the room and she wouldn't have her oxygen on her face. So I would walk up and put it on. And this is the look she would give me when I would force it back onto her face. But then we would giggle about it. And I was like, she's doing great. Can we get out of here? And after 49 days of not being home, she came home. We giggled, we had some wine, and I gave her Christmas gifts. So I got her a pulse ox to put on her finger and cotton candy. Needless to say, she didn't really care about the pulse ox. So something that I like to think about is how are we providing care and understanding for people who might be not understood is, do you rely on asking the family, or can you ask the patient? I mean, she was the patient at the time. So could you turn to her and say, can I get you anything? Or do you turn to the family? Because she can't speak, so she can't ask for more water. Where is the bathroom? Then she's hungry. Where are my parents? I don't understand what's happening right now to me. There was a couple times where we noticed that her water pitcher was never filled because she didn't ask for it. How independent is she? She could drink the water. She just doesn't know where to get the water. She can get to go to the bathroom, but she might need assistance. Maybe we can't understand you, but they can understand your body language. Are you lurking in the corner of the room? Or are you right next to the bed talking to her like a person? So these are the most recent photos. On the left is her at her adult life skills facility making holiday ornaments. And the picture on the right is just this past July for her birthday. And this video is kind of fun. So she helped herself to some ice cream. Oh, doing? Are you going to eat all of that? The look she just gave me. That's it, no more. All gone, no more. This girl does what she wants. So it didn't quite make it to the bowl, but. And that is all I have. So are there any questions?
That was very good, Kim. Thank you so much for sharing so much about your sister. Yeah.
Thank you.
That is good information, I think, for everyone to remember. Yes.
Yeah. Nikki, did you have any questions?
You know, I don't think I have any questions right now. But yeah, it was very informative. I really enjoyed that. Such a hard thing to go through as a family member. It's totally different being a nurse and being a family member, right?
It's terrible. Don't ever do it.
Yeah.
Yeah. I can't decide which one was worse. Us not being able to assess the degree of her stroke, or her having to be intubated. I'm thinking intubated for sure, but both times were very terrible. But
yes, and it would be, yeah, because you can't ask, is this, you know, what you want, or yeah, it's like, oh, you hope you're making the right decision.
Yeah.
And yeah, because that would be very hard to watch, you know, like having her be restrained because you don't want them to pull it out. And
the staff member that came to intubate her, I worked with him on OB, so I knew him. So when he was walking in, I was like, Matt, she's got a small jaw, loose teeth, she's got a big tongue, and I'm like trying to like prep him before he does it. And he's like, Kim, I got it. but I'm like, please just take care of my sister.
Right?
Tell you. Yeah.
Yeah. It's a total different experience then.
Yeah.
Yeah, I'm doing it for somebody else, right?
Absolutely.
But at least she's doing awesome now, right? That's great.
Yes, she's doing great. She's sassy, and every time she gets a cold, we panic.
Right.
So I every month I buy her vitamins. So like we're gonna make sure that we're not missing any steps.
Yep. Yeah, especially since she can't tell you, I suppose, when she's not feeling the best, you know, or
Right.
whatever. Yeah.
Yeah.
Mhm. Yeah. Oh,
Well, that's it. Yeah.
all right. Thank you so much. And
Yeah. Thank you, Nikki.
all right, thanks. We'll
Yes.
talk to you later.
Yes. Have a good day. Thanks, guys.
Bye-bye.
Bye.